Hello everyone, Dr. Dwivedi here, board certified cardiologist. I currently practice in New York City, and today we're going to discuss 7 ways in which you can lower your blood pressure without the use of medication. Simply put, your blood pressure is the amount of force your circulating blood applies to the walls of your arteries. It dictates how much force your heart has to use to pump the blood to your body and how much blood your organs receive. It is tightly regulated and varies throughout the day, just like your heart rate. It is impacted by what you eat, your environment, and even something as simple as if you're sitting or standing. When your blood pressure is too low, your brain doesn't receive enough blood. This can lead to lightheadedness, dizziness, and even blurred vision. On the other hand, when your blood pressure is too high, your heart has to push against a much higher resistance. Imagine walking against the wind or climbing up a steep mountain. When your blood pressure is chronically elevated, that's essentially what your heart is facing. Over time, if high blood pressure is untreated, it can damage your kidneys, your heart, your brain, and even your eyes. Unfortunately, the symptoms of blood pressure don't manifest until the very end stages. That is why it is important to make sure that you have a normal blood pressure, and a healthy lifestyle goes a long way in ensuring that your blood pressure is optimal for your body. Number 1, limit your salt intake. I always tell my patients, if there's one thing you can do to help your blood pressure, that's to limit your salt intake. Salt consists of 2 compounds, sodium and chloride. Sodium is needed for many essential functions in our body, including the functioning of our nerves, our muscles, and even maintaining our blood pressure. Most people need about 2 to 3 grams or 2,000 to 3,000 milligrams of sodium per day. If you have high blood pressure, you probably want to limit the sodium to about 2,300 milligrams of sodium per day. However, studies show that most Americans are eating too much salt or sodium in their diets. And honestly, it's not that hard to do so. If you decide to snack on a bag of chips, that's about 12 to 1,300 milligrams of sodium. That's already half of your total daily sodium requirement. A slice of pizza takes you to about a quarter of your total daily sodium requirement. I always advise my patients to read the labels on the foods and groceries that they're buying. Common foods with high sodium include canned foods, salad dressings, cured meats, and takeout food. Some easy ways to eliminate salt or sodium in your diet include using non-salt-based flavoring for your food. For example, if you're making a salad dressing, try to use vinegar or lime juice instead of salt. Or if you're cooking, flavor your food with herbs like rosemary, thyme, or chili flakes instead of salt. Number 2, incorporate potassium-rich foods in your diet. Potassium is another essential compound in our body. It works closely and almost as a counterpart of sodium. It helps to maintain our blood pressure, the functioning of our nerves, and is essential for maintaining our heart's rhythm. Unlike sodium, studies show that most of us don't get enough potassium in our diets. A diet rich in potassium can lower your blood pressure up to 6 to 8 points and has even been linked to lower risk of strokes. So how does it do this? When we eat a diet rich in potassium, our kidneys dump more sodium into the urine, lowering our body's sodium levels and our blood pressure. Potassium also works on the walls of your blood vessels, easing their stiffness and tension. So what kind of foods are high in potassium? Bananas are popularly known to be high in potassium, but be careful because they also contain sugar. Some heart-healthy foods that are rich in potassium include green leafy vegetables like spinach and broccoli, foods we typically avoid ordering on the menu. Other plant-based foods like peas, lentils, and beans are also heart-healthy, potassium-rich foods. Number 3, get moving. Exercise helps to keep you physically and mentally healthy. When you exercise, it helps reduce the stiffness of your blood vessels, which helps the blood to flow around your body with less resistance. Regular exercise can reduce your blood pressure by up to 10 points, but every little bit counts. Even doing half an hour several times a week is beneficial. Not only that, exercise also helps with weight loss. And guess what? Weight loss helps your blood pressure. So you're killing two birds with one stone. My patients often ask me, well, what kind of exercise? Typically, it's anything that raises your heart rate and gets you sweating. So things like brisk walking, swimming, biking, or even dancing are all helpful. High intensity interval workouts can also benefit your blood pressure. Number 4, watch your waistline. Excess weight gain is directly linked to development of high blood pressure. When we gain weight, the extra fat causes more resistance to blood flow in our body. So our heart has to push harder and work overtime. Not only that, but weight gain also activates pathways in our kidneys that signal them to raise our body's blood pressure. The most harmful type of weight gain is that around our gut or our waistline. This has been linked to development of high blood pressure and higher risk for heart attacks. But the good news is that every little bit counts. So for every kilogram of weight that you lose, your blood pressure typically comes down by 1 point. That's why it's important to keep working towards maintaining a healthy weight for your body. Number 5, manage your stress. Stress is inevitable in our daily lives, and in short doses, it can actually be helpful because it helps us to deal with dangerous or life-threatening situations. When our body experiences stress, it releases stress hormones, which in turn raise your blood pressure, your heart rate, and release more sugar into your bloodstream, so our body can tackle the life-threatening situation. The problem really comes in when stress becomes chronic. Chronically elevated stress hormones can lead to high blood pressure, weight gain, and even heart disease. So it's important to find activities that help you manage your stress, whether it's exercising, spending time with your family, painting, or cooking. Find what works for you and incorporate it into your daily life. Number 6, get a good night's sleep. Sleep is so important and it can really make or break your day. Sleep is a time when our body heals and recovers and repairs itself. When we don't sleep enough, we get tired and cranky, and it puts our body in a state of stress. Chronic sleep deprivation can cause hormonal changes that have been linked to development of high blood pressure and even heart disease. Not only that, when we don't sleep enough, our body produces more hunger hormones, which cause us to be more hungry. And let's face it, when we're tired and cranky, we're less likely to make healthy food choices. Both these things can cause weight gain in the long run. Unfortunately, weight gain itself can impact your sleep if you develop a condition called sleep apnea. So you can see that it becomes a vicious cycle. If you're having trouble sleeping, try to set a schedule and stick to it. Also make sure that your sleep environment is conducive to good rest. If you're having trouble sleeping or have interrupted sleep, then your doctor may even want to test you for sleep apnea. Number 7, be mindful of your medications. Many over-the-counter or prescription medications can contribute to high blood pressure. Common painkillers that you might find over-the-counter, like ibuprofen or naproxen, are okay in short-term use or infrequent use, but when used chronically, they can contribute to high blood pressure by impacting your kidneys. Also, common decongestants like pseudoephedrine or phenylephrine can raise your blood pressure. If you already have high blood pressure or are trying to lower it, talk to your doctor about alternatives you can use to these common over-the-counter medications. Also, it's always important to review your medications with your doctor to make sure that you're taking the right medications based on your medical history. In the end, I want to emphasize that a healthy lifestyle is important regardless of if you take medications for blood pressure or if you're trying to lower it without medications. Healthy habits feed into each other and keep company. If you eat healthy and exercise, you'll probably sleep better and keep the pounds off. If you get a good night's sleep, you'll feel less hungry and make better food choices. You get the point. Healthy habits become a virtuous cycle, and unhealthy habits become a vicious cycle. Of course, it's hard to do, but making the effort is half the battle. If you like this video, please like and subscribe to my channel. If there are other topics you'd like to hear about, please comment in the section below.